Now, the spinal decompression is only part of the answer. One of the things that we implement with our spinal decompression patients is an exercise regimen. Now, that may be extension exercises, maybe core stability exercises. Naturally, you want to keep your spine healthy as possible. Also, there's a certain nutritional component. If part of your problem is being overweight, for example, you have to address these issues. So there's a number of components. It is not just a machine putting some traction on the lower back and boom, you're done. It just doesn't work that way. There's a number of components that need to be addressed. Well, these are some of the, I guess, the simple questions that you may have asked about spinal decompression. So why don't we go take a look at the machine, point out some of the components, and just give you a demonstration on how it works and how effective it really is. Okay, so here we are. This is our spinal decompression unit. Now, as we had mentioned before, there's three basic components of a spinal decompression unit. The first, of course, is the computer-assisted traction unit. Now, it puts things into different components. You can create your logarithm with hold, with pull, with force, with release, the amount of time. That's all computer generated. You have to know what components to set. The next, of course, is the table. The table is set so that it should be able to move up and down in different components. That allows us to change the angle of the pull. And of course, this belting or harness unit, patients are strapped into this to secure the pelvis, to secure the thorax, so that when we do traction, it doesn't cause any slippage. So what we're going to do is we're going to take a walkthrough of a typical patient on what we would do to set them up, to put them on the unit, to set some settings and just show you what's going on. And we have Danielle volunteer to show us what's going on and help us with the demonstration. All right, this is Danielle. Danielle has a history of lower back issues. She was a figure skater and a gymnast and had some chronic recurrent injuries. Now, we have already done all of the examinations, so we know what type of problems we're dealing with. What this is meant to do is demonstrate what a spinal decompression unit, how she fits into it, what it looks like. All right, the first thing we're going to do, of course, is just get the patient laying on the table. Danielle is on her back or supine because that's the way her particular problem will be addressed. Now what we do is first secure the pelvis in by utilizing these straps. So the straps come in, and then part of the harness is hooked up and snugged up there. We stabilize the upper body with, again, a set of straps. Velcro, very easy to use and very easy for the patient to get out of. One of the key components in any decompression is the patient emergency stop. That means if they have any issues, all they do is push the button and it immediately stops and there's no further risk. Now what we do is the setting on this, there's certain hold, certain pull patterns, and again we create a logarithm that's going to go through a series of hold, release, pull, rest. In this particular case, we're going to use some very low weight to get started in this. We'll set the speed at just a medium. There's not very long. We push start and this logarithm starts. And what happens, this cord begins to tighten. It draws on the harness and then goes through a hold phase, a release phase, a pull phase, and on and on and on. Now, this causes that decompression in the disc that we were talking about. Typically, a treatment time is about 15 minutes, 20 minutes, and then there's some exercises that go on top of that after the patient has done this particular. Spinal decompression, again, as we mentioned before, it's very, very effective in a number of different cases, but in just as many others, it's not a good therapy for. To find out, you need to come in, get a consultation, do the evaluation to see if you are a candidate for non-surgical spinal decompression.